Oklahoma voters last month approved State Question 788, seemingly clearing the way for dispensaries to open later this year for the sale of cannabis products for medical use. But advocates say actions by the State Board of Health this week have violated the spirit of the law and threatened to delay the rollout of Oklahoma's medical marijuana program.
Raymond Jennings is a stage 4 cancer survivor who's undergone numerous chemotherapy treatments. He says he tried every medication known to science to treat his nausea, rejecting his son's efforts to persuade him to smoke marijuana to relieve his discomfort. 4 years ago, with a feeding tube sticking out of his chest because he couldn't eat or drink, he finally relented.
I smoked a little bit out of a pipe. Within minutes, I felt my whole body calm down. Now, if I had to do an edible or whatever form to take it in besides smoking, it would have never worked for me.
Jennings has also used CBD oil to treat the tumors on his tongue, but credits the smokable marijuana with saving his life.
If I didn't smoke, I would not be here today. So smoking, to take that out, is a non-starter.
Yet medical marijuana supporters say that's what the State Board of Health did this week by approving rules which would ban the sale of smokable products from dispensaries in Oklahoma. The board's action came one day after a news conference by a coalition of medical professionals insisting a ban on smokables be adopted.
This issue is not an option and really is more of an absolute demand.
Dr. Jean Househair is the president of the Oklahoma State Medical Association. She says the issue of smoking marijuana is one that doctors feel very strongly about.
You can get excellent care without the smokables. And let's not go backwards. We have fought so hard in our state against tobacco and its incredibly harmful effects.
The ban on smokable products was one of 3 recommendations by the medical organizations, along with a proposal to limit the number of dispensaries allowed to operate in the state and requiring a pharmacist be on staff at each dispensary. During the health board meeting Tuesday, General Counsel Julia Zell told the board the draft rules put together by staff did address the issue of smoking.
We've put provisions in the rules that tie smokable medical marijuana to the Smoking in Public Places and Indoor Workplaces Act, stating that if you're going to smoke marijuana, you can only legally smoke it in the same places that you can currently smoke tobacco.
But Azell also cautioned the board that a ban on the sale of smokable products could be seen as running counter to the will of the voters who passed State Question 788 and could invite legal challenges.
I think most voters, when they went to the ballot box and voted for this, assumed that this would be smokable marijuana, just, kind of a common sense approach.
Despite those warnings, the board amended the draft rules by a vote of 5-4 to adopt 2 of the 3 changes sought by the Oklahoma State Medical Association, requiring the presence of a pharmacist and banning the sale of smokables. Interim Health Commissioner Tom Bates admitted those decisions are likely to be challenged in court, adding the board's actions were not chiseled in granite.
I would expect some type of litigation to be filed about these rules regardless, even if they had passed the rules as submitted.
The new rules drew an almost immediate response from medical marijuana proponents. New Health Solutions Executive Director Bud Scott released a statement saying the unelected members of the Oklahoma Board of Health have decided their opinions about medical cannabis are more important than the opinions of over 500,000 voters. Chip Paul with Oklahomans for Health was even more blunt.
We've been working very hard on trying to get these regulations right. I would say thousands and thousands of Oklahomans across this state have participated in that process, a very iterative red line process. And yesterday, the Department of Health, the Board of Directors, just literally spit in our face.
Paul argues the board's actions effectively usurp the will of voters who overwhelmingly approved State Question 788.
There's no way in 788 that we expected anyone to take away our right to smoke medical marijuana under that program. No way. So if anyone thinks that that's reflecting the spirit and intent of that law, it's not.
ACLU of Oklahoma Executive Director Ryan Kiesel also believes the board's actions violate not only the spirit, but the letter of the state question.
Over 500,000 Oklahomans spoke directly to this issue. And I think that what the Board of Health has done here is most likely outside of the power that's been granted to them by State Question 788 to come up with these rules.
And Kiesel says the board's actions create a couple of possible scenarios.
The first option would be either the ACLU or some other group, other individual, or a collaboration between those groups filing a legal challenge to these rules that were promulgated, or the state legislature could come back into special session and address these changes immediately.
Governor Mary Fallin has thus far rejected calls to bring lawmakers back into special session and on Wednesday signed the new rules into effect, calling them the best place to start in developing a proper regulatory framework for medical marijuana, adding, "I know some citizens are not pleased with these actions, but I encourage everyone to approach the effort in a constructive fashion in order to honor the will of the citizens of Oklahoma who want a balanced and responsible medical marijuana law." State Question 788 is scheduled to become law July 26th, with the Medical Marijuana Authority accepting applications for growers, processors, dispensaries, and patients as soon as August 25th.